Imagine for a moment that the person you love most in this world was diagnosed with a dreaded disease. Now imagine them asking you to help them in their life. Could you do it? How would you do it? A gun? Pills? An injection? I know. Let's ask the doctor. Euthanasia is the practice of ending a person's life with either an incurable disease or is in intolerable pain. It can have many negative ramifications, and I intend to persuade you that it should remain illegal. This is a topic that I have been researching for several years now and have written several papers about it. Today I'm going to talk about the effects legalizing euthanasia will have on the legal system, the medical field, and the family. Let's begin with the legal system. According to the article Euthanasia in Regional Perspective, euthanasia is legal in several states such as Oregon, Washington, and Montana. Oregon has attempted to safeguard their patients by requiring multiple doctors to evaluate them for depression and other mental illnesses. If depression is suspected, the patient must be sent for a mental evaluation before they can be euthanized. However, according to Vicki Robinson and Helen Scott, the number of patients that are sent for those evaluations has dwindled to almost zero. You may be wondering, so what? Well, this tells me that doctors have become complacent with killing their patients. When someone dies, the police have to determine the cause and whether or not someone should be held legally accountable for that death. Did the patient really decide on their own that they wanted to die, or did someone convince them that they would be better off dead? Intent is hard to determine, but our legal system is expected to determine intent every day. Court systems would stay backed up with people arguing between homicide and suicide. Insurance companies would refuse to pay because they would consider the death to be a suicide. These unnecessary lawsuits could be prevented if people would just not try to play God. Now let's talk about the medical field. Doctors and nurses take an oath to save lives. If euthanasia is legalized, the doctors and nurses will be required to take lives instead of saving lives. An article in the Journal of Law, Medicine and Ethics agrees that legalizing euthanasia will force doctors to add death plans to their treatment options. Legalizing euthanasia could easily go from the right of a patient to die to the duty of a healthcare provider to kill them. Is it really fair to expect a doctor or nurse to kill someone regardless of their religious or ethical beliefs? How would you like to be forced to give someone a lethal injection? Who gets to decide who can die and who must live? Euthanasia will require many policies and guidelines, and the enforcement of such policies would undoubtedly take away resources from the helping patients. Doctors should be healers, not killers. Finally, let's talk about the loved ones that are left behind. Generally speaking, I agree that a person should be entitled to his or her own actions. Since most people don't live in seclusion, their death will affect someone else. Family and friends that are left behind to deal with the grief and guilt of agreeing to euthanasia. Every commission of euthanasia involves people other than the person that is dying, so you cannot possibly believe that euthanasia has no victims. To assist in the death of a sick person shows little regard for human life and a total lack of moral values. To wrap things up, I would like to remind you that legalizing euthanasia would be a grave mistake. Even if euthanasia could be justified by an individual person, the harm that it would bring to the institutions of law, medicine, and family greatly outweighs the benefits of a person. Euthanasia cannot be allowed to become a standard practice. So next time you hear someone say that someone else would be better off dead, stop and think about what that really means.